I would like to thank Ms. Naomi. Allow me now to summarize the discussions held during the multi-stakeholder panels and to deliver concluding remarks as President of the General Assembly. Excellencies, distinguished guests, ladies and gentlemen, we have come to the conclusion of a very successful high-level meeting. As our discussions today have made abundantly clear, the road to ending tuberculosis requires strengthening health systems and multi-stakeholder collaboration to address the key drivers of the epidemic. We also need to strengthen research and development supported by sustained financing. I am proud of the progress we have made today. First and foremost, we approved a milestone political declaration that revitalizes commitments with concrete targets to ramp up TB response over the next 5 years. We resolved to strengthen political will and promote cooperation with all stakeholders, including private sector and civil society, as we strive to implement a comprehensive people-centered response to ensure universal access to TB prevention and care services, including for children. We delivered on leveraging lessons from the COVID-19 pandemic to scale up adequate and sustainable financing for better service delivery, as well as for the research and development of new diagnostics, vaccines, and drugs. All of these actions must be based on science, evidence, and best practices. We promised to integrate human rights and gender-based approaches and to address stigma and discrimination in all policies and actions towards ending TB. And we committed to ensuring adequate and predictable financing to sustain our efforts in the long term. In addition, we held two very fruitful multi-stakeholder panel discussions. In panel 1, we recognize that TB response must be transparent, robust, and cover all populations. I repeat, all populations, including refugees and migrants. We heard that accountability mechanisms, including those led by civil society, are essential. We must close the access gaps that have only widened due to COVID-19, conflict, and other disasters. In panel 2, we heard that greater domestic and international investment in TB services, including community-based services, would strengthen both the reach and the quality of care. Political will is an important driver of health financing, and engagement with parliamentarians is particularly important in this context. I commend member states and stakeholders, including representatives from civil society, academia, researchers, the private sector, and the UN system for their active involvement. Your presence has truly energized and enriched our discussions today. I am encouraged by your inspiring and powerful words and by your innovative and comprehensive suggestions. A number of countries shared the progress achieved since the first TB high-level meeting by implementing strong and actionable national strategic plans, backed up by adequate funding. I applaud your commitment. Excellencies, before closing, I would like to thank the co-facilitators, His Excellency Krzysztof Szyszewski, Permanent Representative of Poland, His Excellency Banghitor Ibragimov, former Permanent Representative of Uzbekistan, for their hard work in leading the intergovernmental negotiations for the political declaration. My deep gratitude also goes to the co-chairs of the two multi-stakeholder panels, His Excellency Mr. Budi Gunadi Sadikin, Minister of Health of Indonesia, Her Excellency Ms. Karina Rando, Minister of Public Health of Uruguay, Her Excellency Dr. Kalumbi Shangula, Minister of Health of Namibia, and Her Excellency Dr. Alexandru Rafila, Minister of Health of Romania, for their invaluable contribution and time. Let us join forces to wipe out this millennia-old killer. Together, we can end TB. We can end. We can end. Thank you. Oh, I have to close. The high-level meeting of the General Assembly on the fight against tuberculosis is now concluded. The meeting is adjourned.